The other theory, which is far more recent, is the dopamine hypothesis of bipolar disorder. And there's quite a lot of evidence that an elevation in dopamine leads to mania, or at least symptoms that look a lot like mania. So some of the evidence is things like levodopa, which is a drug that's often given to people with Parkinson's disease. Neurons that produce dopamine in the substantia nigra have broken down, and that leads to these problems with movement. And actually, a lot of people with Parkinson's have problems with mood as well. They often have depressed mood because of a lack of dopamine. So people that were given levodopa or L-dopa often experience hypomanic type symptoms. If you give levodopa to people with bipolar disorder, you start seeing hypomanic symptoms pretty much immediately. If you give amphetamines, which elevates dopamine, to pretty much anyone, you start seeing hypomanic type symptoms. Then if you look at, for example, there have been studies where they've stimulated the ventral tegmental area, which is another part of the brain that produces dopamine in the reward pathway, in people with obsessive compulsive disorder. And these people have started to display hypomanic type of symptoms. With brain imaging studies, they've found that dopamine receptors tend to be very active or very open and whatever during manic episodes, and they've noticed that transporters tend to be overactive in depressive phases.